Good morning, I'm Miranda Anderson, Clinical Nurse Educator, and today I'm going to talk to you about the Kangaroo feeding pump. Couple of things, you do need to keep this pump plugged in at all times. The battery life on it is very short, so definitely keep it plugged in. If you are needing a Kangaroo feeding pump, we have approximately 11 in-house. You need to check your clean storerooms for them first. If you do not have them there, you can always check with Biomed as maybe they're down for repair. We do have a couple of feeding tube systems that you would have choices from. This is a feed bag system and a flush bag system. So the feeds that I would use for this are ones that might come up from dietary in cans that I can just add to my bags. You also will see, and then this is my flush bag for my water. You will also see the system that has a flush bag and just a spike. Some of our feedings come in pre-made bags. For instance, the renal one does. I would just spike that pre-made bag and I am good to go. First thing that I'm going to want to do is I'm going to need to load the system. So there's a little blue door here on the side. You're going to want to open that up. On my tubing system, I have tubing that is more pliable that's going to go around this little wheel here. This will only fit in one way. If I try to put this little lip in backwards, it won't fit. That needs to be facing out, and then it's going to go around the black roller clamp, and then this little weight will sit right in here, and then I can close my door. Okay. To turn it on, I have one power button, so I can go ahead and click it, and it'll load up. I can keep my settings. Sometimes with patients, your feedings are 6 p.m. to 6 a.m. I can keep my settings if I'm using it for the same patient, or I can change my settings and hit clear settings if it's a new patient. I have the choice to prime my pump if it's not already primed. I have the choice to adjust my feed and adjust my flush. I'm going to start, if it's a new patient, new feeding, you're going to prime your tubing first. If it's something that I've already had my tubing primed, I can go ahead and do my adjust feed. So my adjust feed is one thing, my feeding rate and my feeding volume. One thing we have is in Cerner, we have enteral tube feeding power plans. I strongly encourage you to work with your physician and use those power plans. They have rates already established on there. They'll have volumes. They have the medications on those power plans if your PEG tube would become clogged on how to unclog it. They have your residual amounts on there, your water flush guidelines, to how much to flush after you give meds, after you give a bolus, things like that. So I strongly would recommend that you ask a provider if they are using those. So my feed rate, I'm going to choose, my doctor's running mine at 40. What you're going to do is you're just going to choose the arrow over to the spot in the number that you want to change. So if you would go past the 4, just keep hitting the button. It'll come back around and you can utilize it. Mine's running now at 40 milliliters per hour. Just hit enter when you have that. My volume is going to be how much my doctor has ordered, and mine is 900, so I'm going to choose 900. And hit enter. And then at this point, if you do not have an ordered flush, you could hit run. But we have a flush that's ordered every 8 hours, so I'm going to hit done on the bottom left side. And I'm going to choose my adjust flush amount. And so I'm going to say my volume is 200. Hit enter. And that is every 8 hours my doctor has ordered that. And then I will hit enter. So at this point, I can go ahead and I can click run. You will see a little teardrop come down on the right side of the pump. It shows you my rate, it shows you my flush amount and the frequency of my flush, and then my volume of my feeding. It will toggle back and forth between my feed and my flush for amounts that they have received, as long as they are receiving that. If your patient has to be laid down flat due to being involuntary or incontinent, CNAs should not be the ones. They do not do outputs for these. They should not put them on a hold. The nurse needs to put them on hold. So I would need to come in here and I can put them on hold. You have a hold button here on the left side. I can just hit hold and I can choose. This is where I can clear my volume amount at my every 8 hours as my nurse. And then I can also choose to resume it in 30 minutes. Maybe we're going to be in there giving them their bath and we want it to resume in 30 minutes. Or maybe they had residual too much and we need to hold it for an hour. We can resume it in 1 hour. Okay. The other thing I have in here is maybe I just gave my patient their medications and I have an order to flush now with 30 milliliters per their enteral tube feeding power plan. There is a flush now button on the left side at the bottom that I can choose. I can set my amount to what it is, and it's 30. I can hit enter, and it's going to do a flush now, and you'll hear it speed up. It's always good to notify your patients as this is loud compared to what they're used to it running. Once that volume has been flushed, it will automatically turn back over to the rate. If you get a warning like this, it's just letting you know that either your bag's empty, it's clogged, something's clamped. You can hit continue, or you can stop alarm. Okay? So once you've done that, it will start flushing again, and then you are able to start your feeding once your flush is done. To turn the machine off at the end of your shift or at the end of the feeding, all you have to do is hold your power button till it counts down from 3, and it will shut off your machine. And that is how you use the Kangaroo pump. Thank you.